what is the assurance for the stem cells donor? For instance, today the blood donation is very popular. Why? Because the assurance is people know that they get the blood back in 24 hours.
Correct.
Right? Does the stem cells also generate the same way, and the donor need not have to be worried about donation?
Correct. In fact, here we are even one step better. When we are collecting the stem cells, I told you we're going to give 4-5 days of this growth factor injection. So it's not like we are depleting anything from the donor. We are actually kicking the marrow and increasing the count.
Okay.
And then collecting that excess count. So normally when you do a WBC count on a patient, it's in that 5 to 10,000 range. When we give the injection, it becomes about 30,000-40,000. And that subset is what is collected. So we're truly not depleting anything from the donor, so no risk. And whatever we've collected is regenerated in 24 hours straight away, because the white cell turnover is so high.
Okay.
So immediately they're back to their normal levels in about 24-48 hours.
Okay.
So no risk from that point of view.
You don't have to be worried.
It's only that when you have the poke of the growth factor injection, it's like an insulin injection, so no pain really. Some people can complain of a little bit of fever, body pain, bone pains, because it's actually stimulating the marrow. Generally we just manage with mild painkillers like paracetamol. That's enough for 2-3 days, and that's it.
Okay.
And it's an outpatient procedure. It's longer than the blood donation, because blood donation usually takes about half an hour. This takes about 3 hours.
Okay.
Because it takes that much time for the cells to be collected. And that's done, and then they go back home the same day.
Today, do we have the stem cells bank similar to the blood banks in the country?
Yeah, in our country, we only actually have major private cord blood banks. We really don't have a public cord blood bank. Our hospital is actually trying to initiate that and collect and keep. But most of the banks are private cord blood banks, and they collect cells and store it for your own child's sake. It's not something which can be given away to somebody else. And most of the time you hardly ever end up using it for your own child, unless there's a history of thalassemia in the family or leukemia in the family where somebody may potentially use it. So these are otherwise just sitting there stored. So we really don't have this public cord blood bank facility in our country. And that certainly is a need now. And if we can replicate the models which are done in Europe and in the US, it's something which will certainly be useful to our country. We certainly don't have a shortage of cord blood, because of the sheer number of deliveries. It's only that we need a facility to collect it and store it.
Okay. Doctor, I'm curious to understand, when do you decide that a patient needs stem cells transplantation? Because let's say a cancer patient, depending on the stage of the cancer, the patient goes through the chemotherapy, right? Is this stem cells transplantation or the question is, can we do away with the chemotherapy for cancer patients directly by going to stem cells transplantation, or is it given over and above that?
It's usually a top-up after chemotherapy, because it is actually more intensive than the chemotherapy.
Okay.
So in a lot of diseases, initially the chemotherapy itself will achieve some kind of cure rates. When you can't achieve that, that's when you look at doing something which is more than just standard chemotherapy, and doing a transplant where you're actually trying to change the entire system in the bone marrow. So that's the basis and the logic for actually doing it. It is more than just doing the initial chemotherapy. But nowadays, with the advent of what we call as monoclonal antibodies being available, even chemotherapy is slowly being tried to be phased out. The best kind of treatment is if you have an antibody which will go and hit only the cancer cells and nothing else. That would be the best treatment for any cancer. As of now, when we give chemotherapy, these are all kind of blanket treatments. It just goes and hits everything. So that's why you get the side effects. So now there is research that for each type of cancer, identify what antigen it expresses, get something to just go and selectively go and hit him and knock him out. So with more and more that kind of treatments being available, and we call it immunotherapy, where the cells recognize this tumor cell as bad and knock it off. These are advances which are coming up, and that's the best treatment for cancer. Till that point in time, we still need to do a little bit of this blanket treatment and then top it up in some situations with stem cell therapy. That's for the cancerous situations. We must also remember that there are a lot of non-cancerous diseases where you need to do something like this for a cure. And one classic example is thalassemia, which is a common problem in our country. It's located in particular areas of the country, the northeast, the Gujarat, Sindhi community areas. But now with so much of intermixing going on, we do have patients even from Bangalore who come in and suddenly you make a diagnosis of this problem, where lifelong blood transfusion is the only treatment. And that's not something easy to go on doing for a child. So there, in situations like this, we may have to actually just change the bone marrow and put in either sibling or an unrelated stem cell donor and try and treat that disease. So non-cancerous diseases also have a role, and there it would be upfront treatment for that disease with an idea to cure the disease.
And doctor, how popular is this therapy in this country, and what are the survival rates? Do you have maybe some case to talk about that?
Yeah, so the survival rates actually differ from each kind of disease. So in leukemias, most of the time we are doing it after the initial chemotherapy when they don't show response, and at that time without transplant we are looking at a 10% chance of survival. That goes up to about 60 to 70% chances when you do a transplant, because you are changing the cell, and also there's something called graft versus leukemia effect, where the donor cells will prevent the leukemia from coming back. So nothing reaches 100% for sure, or even 90%, but 60-70% are the cure rates, which is better than what it would be without that treatment. Okay. But in diseases like non-cancerous diseases like thalassemia or even aplastic anemia, the cure rates are almost close to 90%. If they're done very early, before the patient has any complication, then things go very smooth. You just replace the cells, the new cell starts growing. In about 3 months, the disease is done, and there you're hitting very high cure rates.